Hi, my name is Ebony Byers, and I will be giving an overview of a program designed to help individuals with substance use and abuse, more specifically parents. So, an overview of substance use and abuse in Australia. So, according to the World Health Organization, substance abuse can be defined as the harmful and risky use of psychoactive substances, and this can include prescription medication, over the counter medication, illicit drugs, and alcohol. Recent statistics have shown that in 2016, 16% of Australians who were aged 14 years or older illicitly partook in substance use, and this number jumped to 20% for those aged in the bracket 20 to 29 years. It was also found that the top 4 illegal drugs that were commonly abused were cannabis, ecstasy, cocaine, and methamphetamines. This is really interesting that this finding that the most commonly abused substances were actually all illegal substances and not really anything to do with prescription medication or over-the-counter medication. From this use, there are major impacts including addiction, violence, removal of children, health risks, and even fatalities. In 2016, there were 1,808 recorded drug-induced deaths in Australia. Since 2011, there has been a significant increase in drug-induced deaths, which was relatively stable between the late 1990s and mid-2000s, and this increased in the mid-1990s. Altogether, as a social issue, the use of drugs can lead to immense costs for the government, which overall affects society. Some of the societal impacts of substance abuse can include ongoing and an increase in criminal activity, individuals driving under the influence, which can lead to motor vehicle accidents. There can be family, domestic, and sexual violence, and even homicide. There are immense pressures and impacts upon the family and friends of those who abuse substances, as well as the impact upon children and the trauma that this can cause for them at such a young age. The trauma in children, especially children in out-of-home care, is such an ongoing issue. And statistics often say that children who grow up in these circumstances are more likely to become substance abusers themselves. So some of the causes of this issue can include experimental use, especially for teenagers. A lot of parents usually will state that their early drug substance abuse started in their teenage years, just for experimental use. Prior childhood and adult trauma, and most likely using illicit drugs as a means for an escape. Enjoying the feeling of drug use, which can give energy, alertness, and feelings of euphoria. Environmental factors such as peer pressure, mental health disorders, a lack of family and friend support base, and a family history of addiction. How is this issue currently managed? To date, there have been numerous attempts to combat this social issue. One method that has been the introduction of methadone clinics around Australia. A methadone clinic is a specific clinic which prescribes methadone, which is a prescription drug that is part of a group of drugs referred to as opioids. The use of opioids allows for specific receptors in the brain to produce a response within the body, which leads to feeling of pain relief, relaxation, pleasure, and contentment. Often, this type of prescription drug is taken as a replacement of illicit drugs to treat dependence upon illicit drugs, and this is known as pharmacotherapy. This type of therapy allows for prevention of physical withdrawals, increase in well-being, stabilization of lives for individuals who substance abuse, and attempts to reduce the harm of drug use. Whilst in theory, methadone clinics have the ability to provide quick-acting support for weaning off illicit drugs, it doesn't actually offer a sustainable long-term support, as most programs usually only run for 12 months. Therefore, this increases the risk of drug abusers falling back into their old habits upon completion of the program. There are numerous other government initiatives, such as counselling, hotlines, criminal punishments, that have attempted to combat illicit drug use with minimal success, because illicit drugs are so very prevalent and readily available in today's society. This, mixed with addiction, creates an enormous social issue that feels almost impossible to combat. A positive psychology approach. Positive psychology is now becoming more recognised as a holistic way to treat social issues, including drug abuse. Research has demonstrated that those who are addicted to drugs or alcohol have an increased responsiveness to stress and craving, whilst also demonstrating that a positive emotional state has a direct correlation with lower stress levels and lower levels of craving, whilst in the opposite, a negative emotional state relates to higher levels of stress and craving. A study conducted by Sorochi and Brasford 2009 found that individuals who used substances to cope with their emotions had a significant decrease in their well-being and an increase in emotional stress, whilst a sense of purpose for life and positivity linked to negative use of substances to deal with emotional coping. Overall, concluding that those who have a dependence upon substances may benefit from fostering a more positive emotion to regulate responses to stress. Some of the positive psychology concepts and theories include the hope theory, the strength-based approach, and motivation, and these are all factors that may assist in dealing with those to overcome drug abuse. The hope theory, strength-based approach, and motivation. So the application of positive psychology theories may prove to be extremely useful in combating drug addiction. One of the main consequences of drug abuse of parents is the removal of their children by welfare due to risks of neglect, physical and psychological harm and abuse, amongst other issues such as sexual abuse, and the list goes on. The hope theory provides a pathway for individuals to strive for success and goal attainment. This can therefore be split into 4 categories, being goals, pathway thoughts, agency thoughts, and barriers. This theory explores the notion of goal attainment, and previous research has found that goal attainment is positively associated with positive emotions. This theory really nicely suits the positive psychology concepts, such as the strength-based approach, motivation, and resilience. The use of these concepts, especially strength-based approaches, allows individuals to not feel completely useless or hopeless, and instead focuses upon knowledge, skill set, and capacity building. Numerous studies have found that the strength-based approach is effective, and it focuses on resilience and the positive attributes of an individual. Overall, these concepts and principles are imperative to the application of the intervention that will be discussed next. So the how. So the HOPE program will be designed for group sessions and will operate by incorporating mindfulness, parenting techniques, goal-orientated ambitions for individuals and families. There will be weekly goal and achievement check-ins with short-term and long-term goals spanning over 5 years, allowing for a more longevity of success. A mobile phone application will also be accessible to log goals, emotions, journaling, mindfulness, and self-help strategies when group sessions are not taking place or when sessions are over. This program is specifically aimed towards parents who have had their children removed from their care due to drug abuse and abuse, and also has the ability to target those who suffer from mental health disorders as a result of ongoing substance use. This program will aim to take place in local community settings such as schools, and this would actually even present the opportunity for individuals to feel as though they are within a learning space and are well supported by trained program deliverers. This program will run fortnightly for new groups and runs over an 18 to 24 month span, which follows the general timeline for parents to prove themselves to the Department of Communities and Justice, as known in New South Wales, to have their children restored to their care. Following completion of the program, the mobile phone application will always be available for extra support, a 24/7 hotline, and continual motivation to log emotions and goals. If members relapse in their programs, they are able to join a specific relapse program course that runs for an extra 6 to 12 months just to provide that extra support. In 2016, there was over 16,000 children in out-of-home care in Australia being removed for reasons such as neglect, abuse, and parental drug use. Because of this, there are thousands of children who experience significant trauma, which then leads to having a greater use of substance abuse and mental health disorders themselves. This program aims to combat substance use and abuse in parents and works towards them having the ability to overcome their addiction and be equipped with skills to have their children back in their care whilst also setting long-term goals for themselves. The longevity of this program is essential to the success of its individuals who undertake this journey. Overall, the application of this program will provide a significant support base for individuals overcoming this adversity, and the use of positive psychology strategies allows for individuals to focus on their inner strengths and capacity building, whilst also supporting individuals to practice mindfulness through deep breathing exercises, journaling, and other healthy activities that promote a healthy mindset. So some of the potential limitations for this program includes, whilst in theory the program is designed to combat the substance use, the application and foundation is positive psychology, but there are still limitations that could be found. Firstly, the longevity of this program may not be suitable to all individuals who undertake the journey. Whilst the group sessions only run for 18 to 24 months, beyond this, it is up to the individual to take control of their own life and make the right decisions. And this may not be realistic for some people, especially those who have severe drug addictions or even severe mental health disorders where they find it easy to fall back into those old habits. With illicit substances being so readily available, it can be easy for individuals to slip back into these habits, and they may feel ashamed or embarrassed to admit their mistake. This could also lead to further trauma for children who may be restored back to their parents and continue to be exposed to drug abuse, and even further trauma for children to be removed from their parents' care after a restoration. Moreover, funding could present as an issue. The development of the program itself, along with a phone application, may prove difficult to gather these resources, and finding the correct resources to implement into the program may be difficult. Further, some individuals may not actually have access to the equipment needed for the longevity of this program, such as a mobile phone. Further, intensive support may be needed for those who have severe addictions, and that may be hard to combat. And it could be questions if positive psychology principles are enough to do this. With limited resources to know the effectiveness, it may prove difficult to know the extent of the effectiveness of this program, and further resources may need to be implemented, which can pose another barrier for funding. And that is the end of the HOPE program intervention. Thanks. So the program that I have come up with is called the HOPE program. So that's an acronym for Hold On, Pain Ends. The HOPE program is an intervention created to target parents who have had their children removed from their care due to illicit drug use and abuse. The use of HOPE in the program's title allows individuals to relate to working towards a goal, overcoming adversity, remaining positive, and hoping for a successful treatment and future, whilst also hoping for a better life with their children. This strongly relates to the strength-based approach and the positive psychology principles of resilience, motivation, and mindfulness.